for having me. I am Manelle Suyat and I am from Globe Business. Today, I'd like to share with you how innovations through collaborations and strategic partnerships can be a vital key to a better healthcare scenario. Prior to joining Globe, I have done real estate marketing and retail as well. And if there's any key takeaway, I realized the value of going digital. Real estate and retail were both very badly hit by the pandemic, and staying afloat was hard. The struggle is indeed very real. It felt as though most of us were strong armed into adapting to digital norms. Let me recount the days when we were all forced into the confines of our own homes. It was March 16, 2020, the very first day of the Metro Manila lockdown due to the COVID 19. Most of us were stuck at home, but our healthcare workers, or if I may even say, warriors, battled the pandemic with little to no knowledge on how long the war was going to be. Businesses had to adapt to the sudden drastic change in order not to close down. Creativity and innovation were put to the test. Having worked with various MSMEs and witnessing the hardships they went through due to the lack of digital readiness, I made digitization my personal advocacy. I want to continue supporting MSMEs now, especially in healthcare, with the vision of developing better systems through active collaborations, partnerships, and strategic alliances. But why am I in the healthcare industry, you ask? If there's any industry that values human connection more than any other, it's got to be the healthcare industry. Healthcare professionals devoting time and expertise to help patients in any way possible is the perfect example of type of connection that I would like to emphasize on. The Philippine healthcare industry continues to grow, and along with it, the challenges it has always faced and its effects to its patients, like the rising costs of medicine. Did you know that in 2017 alone, out of pocket spending reached 372.8 billion pesos, 50% of which were for medicine? These costs are driving Filipinos to stop buying medicine that they need altogether. We also face a lack of infrastructure and supplies. Almost 70% of the total MSME healthcare institutions are located in Luzon, leaving only about 8,500 healthcare institutions to look after the entire Visayas and Mindanao. Even the most visited islands experience the lack of healthcare institutions. A good number of incidents have gone viral on social media platforms as distressed tourists are directed to faraway hospitals for immediate care. It's the same thing with our low doctor and staff patient ratio. Half of their healthcare workers provide focused care when they're outnumbered 1 to 13. And to even muddle the patient experience, the use of manual paper processes often result in outdated patient records, missing files, unaccounted billings, and supply costs, to name a few. From a hospital standpoint, we see more pain points on the ground, which keep our healthcare workers from providing better and more compassionate care to patients. These could be administrational, financial, or logistical. Administrational, like outdated patient records and long waiting time during admission and discharge. We see the manifestation of this problem in long lines at hospital lobbies with people waiting to be processed. Financial pain points go beyond the lack of budget and extend to the improper utilization of it. Thousands, if not millions, of unaccounted supplies and assets lead hospitals to doubling orders and spending more when it could have been avoided. It also includes missed opportunities to sell and cross sell services like hospital pharmacies. Instead of directing patients into in house pharmacies, private clinics end up directing them outside their premises due to logistical miscommunications. Speaking of logistical concerns, hospitals face them through complicated patient turnovers and uncoordinated information dissemination between doctors and nurses, especially during shifts. These are just to name a few, of course. All these affect patient needs and expectations, which in turn affects the quality of healthcare our hospital industry provides. It's an unbreakable cycle, each greatly influencing the other. And as the health industry grows, so do people's expectations. For example, a patient walks into a hospital and sees a line of people waiting to be admitted and a limited number of staff ready to answer their questions. Already, the expectation of being well cared for in his head is lowered. But we don't want our standards to be lowered. We aim to raise them because patients and hospital staffs, they deserve better. By arming hospitals with better processes, we raise our patient standards that will inspire us to further innovate and change with the times. Pre pandemic, going to a technologically adept healthcare institution was a luxury. Digitally equipped hospitals were intimidating, and we all knew that the experience was going to burn a hole in our pockets. But what if we tell them that what was once a nice to have is now a necessity? This is where digitization comes in. If you noticed, most hospital pain points could be traced to the use of traditional healthcare models. It has worked for the past so many decades, but times are changing and the availability of new technology is expected to change the landscape. In the traditional healthcare model, processes are paper based with low security for data. The fact that it's patient data is thus not easily updated leads to a physician centric care, wherein the care patients receive are less customized to their unique attributes and more of a general approach for similar diagnosis. Paper based processes also lead to an independent approach of departments, creating miscommunications due to separate processes and databases, making it difficult for doctors treating the same patient to coordinate real time. In comparison, the new digital healthcare model shifts away from physician-centric to patient-centric approach by democratizing the access to patient data between physicians and departments through a secure and seamless database. Going digital could be daunting, but compared to digital systems, manual processes tend to be tedious, time-consuming, and prone to human error and data loss. This makes the patient journey and the hospital processes difficult. Even at the very first step during consultation, patients and hospital staff may suffer from because of incomplete patient records and manual appointment setting. Incomplete patient records could lead to additional precious time used for manually consolidating records, or even worse, incorrect diagnosis. While manual appointment settings can be difficult, especially for patients coming from far places, a small human error can cost them time and resources to come to the hospital only to learn that their appointment wasn't set. It's the same thing when it comes to admissions. Manual record keeping and management may lead to record loss, resulting in longer waiting times during admission, even for patients who already have a record for the hospital. Imagine the frustration patients and their family endure, added on top of worry for their family member. Unfortunately, this follows up to bills and payments. With manual processes, fraud threats are more likely to happen because there's not enough security to detect it. Manual processes also take much more time in consolidating needed documents for payment processing. Documents like the PhilHealth claims forms. How can going digital ease these pain points in the patient journey and staff day-to-day processes? Shifting to digital will boost patient satisfaction by reducing data errors by keeping data updated, thus shortening waiting time during admissions and allowing doctors to coordinate better care for their patients. Guaranteeing high success compliance rate with PhilHealth requirements, making it easy for patients to process their payments with their benefits. Ensuring better accounting and inventory management, thus maximizing the hospital supplies and assets, saving money in the long run. Enabling more research and development through analytics, helping hospitals craft new policies and processes based on hard data. It's time to get ahead and provide better care with digital solutions for tomorrow. So you might want to consider the following. These are just general products that you can look into as a starter for your hospital advancement. I'm sharing this because there's a lot more than what you can find here. When you decide to dip your toes in this innovation, it's honestly exciting and life changing. So, what is ideal? First, a secure, organized, and protected corporate data storage is a must have. Also, having a managed Wi Fi is not just an added feature to your network systems, but it can also be a source of additional revenue. You can assign bandwidths depending on the requirements of each department. And you can also charge clinics a monthly fee for connectivity or in rooms when patients are admitted and they require internet service. Corporate voice will help keep your phone calls up to date through professionally recorded voice features. There are also productivity solutions for seamless, interdependent, and physician collaboration to promote better patient care. Modular and customizable hospital information systems are also available to help automate and organize hospital processes. Protect hospital assets, financial and administrational data and processes through guaranteed cybersecurity. Mobile payment options that are flexible and reflect real time payments can also be made available to your patients. And to ensure that no data is lost or wasted, cloud services are available for accessible large data storage. These benefits could be accessed with a trusted partner that offers a wide variety of digital solutions. You can collaborate with them and work closely with every step of the way towards a common goal. Not only that, but a partnership is a type of relationship that requires the input of both parties, making sure that nobody is left behind. In the long run, a collaboration of this kind will also open more possibilities of learning from each other and developing new and better ideas. Since I'm already here, I know that you can get these products from your preferred partners, but I would like to extend my invitation that we could be that partner for you. Globe Business provides a wide array of digital solutions aimed to help you provide an overall better healthcare experience both for your patients and your staff. From better internet connection to additional payment options, Globe Business also offers a modular and digital system specifically made for hospitals that automates administrative, financial, and logistical processes through a secured platform. This frees up so much resources and will give you more time to focus on providing quality care. With Globe Business, we understand that you need more than beyond digital solutions. As your trusted partner, we make sure to understand your needs with assigned expert account managers and ICT professionals for your tech concerns. We'll be with you every step of the way, from providing connectivity services to your institution to providing support in the form of staff training and solutions onboarding to help you maximize your chosen system. And as your trusted partner, we also aim to make digital solutions accessible through our partnership with BPI Business Banking. Together with BPI Business Banking, we offer the BPI Biz Tech Loan Program, an exclusive term loan facility conceived to make Globe Business digital solutions accessible through flexible payment terms. With Globe Business and BPI, you could safeguard your first steps into digitization. Now, more than ever, we go back to our roots as a society. We've built everything so far through collaborations, partnerships, and strategic alliances, and we will continue to do so as we face new challenges and step into the new age. Growth and innovation are ushered by needs and changing times. And as your trusted partner, Globe Business will be with you every step of the way in providing overall better healthcare for Filipinos. Thank you for listening. I'll be able to answer your questions in the short open forum that we'll be having towards the
The
end of this
digital
session.
age is here. The change has been exponential. That the way we receive news and information has drastically exceeded expectations. Data-driven analytics is not a fancy word anymore that gets thrown around to impress, but rather has become a byword for a fast-growing digital media that delivers timely, comprehensive, useful information received by an audience whose stature in terms of understanding the world we live in is increasing leaps and bounds. We are now in a world highly integrated due to digital media, and now more than ever, socially evolved, connectivity, advocacy-driven demand, and engagement, and the data points that govern these metrics are within your grasp. Blueprint.ph is a communication research firm focusing on big data, thick data, artificial intelligence, and online sentiment analysis, is in the forefront of this amazing transition in our country as we introduce our new Philippine Data Newsroom.